Welcome everybody, and thank you for joining us for part 3 of our podcast series of being a training nursing associate. My name's Noel, and I've got my other trusted colleagues with me, Alex, Harriet, and we've also got Emma sat at the table with us as well. And just want to welcome you all, and thank you ever so much for coming back. Today, what are we going to be talking about? Well, podcast 3 is a little bit about the 3 different areas we're all working in. So we've got part of our week, we're at university. Then we've got often a day at our base ward. And then we've often got a couple of days on our placement. And I just want all of us to have a discussion about how we navigated all of those different things and how easy it was. So who would like to kick me off? Alex.
So I think for me it was a bit of a juggling act because I'd worked at the hospital for a few years, I'd known lots of people, and I just felt a bit all over the place because one day I was in the short stay unit dealing with acute emergencies, the next day I was in V6 just being like, what's happening here? What am I doing? How am I navigating my day here? What is expected of me? So because I worked in the emergency sector for so long, I knew what was expected of me, and then all of a sudden you're in a new environment.
And it's really curious you say that, because I always wondered, and I felt this the same in some ways, because of your prior knowledge of working there. Did you struggle to have your student brain on or your work brain on?
It's interesting you say that because when I went on the ward, because everyone was very familiar with me, I had to very much say, I am a student today. This is my goals and this is how I'd like to achieve it. And until you set those personal boundaries, really people are just going to expect that you know
what you know.
Or what you know.
And I also know that, we're very much dividing this black and white, but I've felt when I've been on the wards or on my placements, there's often a bit of a crossover of 1 minute you're student and the next minute you're sort of HCA, and there's a bit of a blending of those hours at times.
What's interesting about that, though, is as a student, when I did cross in between roles, I wasn't so much thinking of that patient care as a HCA. I was thinking more wholly as a student.
Okay.
And I think what I mean by that is, for example, when you're specialing someone who's confused, it used to be just sort of managing their behaviour, making sure they were safe. But when you become a student, it's so much bigger than that. What I mean is you think to yourself, why is this patient confused? Why, whenever this patient gets out of bed, do they keep falling? What can we do to investigate that?
And that's an interesting perspective because, like you said, because you're coming in as a student, you're now starting to look at your patients as to what's the background, where they're going to go, what's their future treatment, because you're expanding your mind, which is what university is there for, to obviously look at a bigger picture. I mean, for you, Harriet, you wake up in the morning, you've got 3 different directions to go in. How did you feel you navigated that?
Well, for me, I think I was exactly the opposite of Alex. So before this, I had previously done a university degree in a completely different subject, and I had been very regimented with that. So I'd gone, right, this morning I am studying pirates. This afternoon I'm going to work on my essay on tea. I've been very regimented in that. So actually, going into 3 different jobs, it didn't concern me as much. What I was new to was the NHS, because I've never worked for them before. And so actually it was learning all this healthcare stuff that for some people, like Alex has been doing it for years, and I had no clue what I was doing. So actually that's what I really struggled with.
And, being sort of so organised, which we know you wonderfully are, did you find, sometimes there was a little bit of mayhem sort of ensuing between what's going on in one placement, what's going on in the placement, and then sort of what's going on at university?
Oh, completely. I mean, I work in mental health. My first placement was in a research unit which focused on mental health. And for anybody who's worked in mental health will know that you can plan all you like, it's never going to go according to plan. And it's never, you can be ridiculously organised, it's never going to work. So actually that was quite a steep learning curve of trying to be organised, but also not being organised. And I really enjoyed that, actually.
Awesome. And you know, the thing I was going to come on to, and I know this is quite specific towards Emma as well, what surprised me when I met Emma is that she didn't drive, so she had to rely on you know, public transport specifically. And I know that because we live in relatively rural settings at times, you know, I thought it was hard enough going to 3 different places, and I've got a car that takes me door to door. Yet here's another person, bless her, who not only has to get up in the morning, wonder what bag she's taking to which placement, but then having to get on public transport, which, you know, is another level as well, because you often have to wait for things, your day's longer. And to obviously talk about those wonderful experiences, Emma, would you like to share with us how that felt?
Yeah, I think it's been quite daunting to begin with, knowing, especially since, again, similarly to Harriet, I've come from outside the NHS, so I actually didn't know where my base place would be. So when I was given that placement, it was quite away from where I actually live. And so what I found I had to do was do like a trial run. So I had to go and figure out first where this place was that I was going to work in, and figure all that out before I actually begun. So,
and the trial run is a really interesting one. I couldn't advise everyone enough who listens to this that, you know, we are adults, although sometimes we probably don't act it, especially when you're chasing bats on your bicycle. That's another story, guys, for another day. But yeah, I mean, I had to do the trial run because my placement was Wisbech. I was travelling from Melton. It was like an hour and 10-minute drive, and I'm thinking, well, where do you park? How do you get through the security doors to even get on the ward? Who do you speak to? Who do you report to? And, you know, before you even started, your brain wants to explode. And then, of course, on top of that, you're having to do train times and...
Yeah, so this is where you just have to be super organised. So you're getting up quite early and making sure that that you can get on your train on time. And of course, on top of that, we've had rail strikes. So some days it's a case of knowing you're going to have to get on a bus, actually, which is going to be a lot longer. So sometimes my commute can be up to an hour and a half each way. So I mean, you know, you really do have to be organised and be checking the train times and be checking the bus times. And it's the same when I do patient visits as well. You know, it's about knowing where you're going, really. So.
I mean, we all take our hat off because I don't think people appreciate enough the extra you have, because a lot of us around this table have, you know, families and kids, so, you know, that's like another job in itself.
It's quite admirable, actually, to find that along with family life and having to commute every day, I can imagine the stress that could cause, especially if there's a delay or something like that.
Yeah, and don't get me wrong, there have been days like that, but I think overall I've sort of lucked out a bit with my placement, because whereas some people are having experiences where they feel their lines are sort of blurred with their hours, actually I'm having a really positive experience where I am. So actually
it's nice and structured and it's well set up for you.
So actually that commute becomes, you know,
Yeah.
it doesn't matter to me, because actually when I get there I feel like my learning's really structured and I can...
I mean, Alex has an easy life, definitely, because he pretty much lives on the doorstep, don't you, Alex? You could cycle to work, but just don't chase bats.
I haven't taken that role on yet. I will, I might.
Just for the record, everyone, Harriet unfortunately fell off her bicycle, which is why we're making the joke, don't chase bats on your bicycle. Interesting, when we talked about sort of navigating, we've talked about obviously the travel, the sort of doing a dry run, which are all great reasons to sort of get yourself. Did you ever find, like Alex was saying at the beginning, that sort of mindset of going from, so one day my placement, I'm a HCA, the next day I'm on a ward as a student. Technically, I'm allowed to learn and do more complicated things, which really confused me, because you'd think, well, couldn't I do that when I'm a HCA? And then, of course, they don't take into account what skill set you have before you joined the course. And then, obviously, you've got these 2 days where suddenly you're back in university and you're having to really put your theory head on rather than your practical head. For me, I found that really challenging. I make this joke where I'd stand at the end of my driveway and wonder whether I'm going left or right on a morning. And there were occasions where I was driving in the wrong direction, just because you realise suddenly, oh God, I'm not doing that today, I'm doing this. Obviously, a year on, here we are, and I'm a lot more organised for it. I had to learn, because us boys are shocking at organisation.
I think for me, with the academic side, because I've been out of academics for such a long time, and I remember in February when we were having that online discussion about the essay, I